My name is Dr. Howard Kipen, and I'm a physician scientist here at the Environmental and Occupational Health Sciences Institute. I direct one of our divisions here called Clinical Research and Occupational Medicine, or CROM. And those are two very different things, and I'm going to tell you about each one of them, the clinical research side and the occupational medicine side. And we'll start with occupational medicine. You may not all be familiar with what occupational medicine is. It has nothing to do with occupational therapy, which some of you have seen people get after they've been injured or had a stroke. Occupational medicine is the study of the causes and prevention and treatment of illness that arises from the workplace, from your job, and also by extension the general environment. Chemicals, infections, injuries, and mostly it's a specialty that is involved with preventive medicine, although there are some treatments like for injuries that come from badly designed and positioned desks or computers and keyboards. Those are something that occupational physicians may intervene with. Our practice here concentrates a lot on chemical exposures in the environment and what they do to people. And in particular, we have a dedicated team of about 5 physicians who provide care for people who have been or will be exposed to dangerous conditions in their work. These include the employees of the medical side, RBHS of Rutgers University, Rutgers Biomedical and Health Sciences, where we care for about 3,000 individuals who we provide support for, both in terms of pre-employment, making sure that they're not a danger to the patients in terms of carrying infections, and also responding when they get injured at work or where a new policy is needed to control, for instance, a chemical in a laboratory. That's what we call employee health service, and that's directed by our Professor Julie Carruth. We also have an even larger practice where we take care of the rescue and recovery workers who worked at Ground Zero back following 9/11. And we have a large grant from the CDC, the federal government, to care for those workers who were on site and suffered effects, both physical and mental health, from working on the pile and the things that they encountered there. We have about 5,000 of those people registered in our clinic in New Jersey, not the people from New York City, but in our clinic in New Jersey, and they get regular monitoring exams, and they also get care for a wide array of conditions that are felt related to 9/11. And in particular, in addition to the respiratory problems and the coughs and the cancers, there's also a very high rate of psychological problems in these people, analogous to post-traumatic stress disorder, if you know that. And we have 2 PhD psychologists, a social worker, and many doctoral psychologist trainees who provide care for the mental health side of these problems. That's the occupational medicine side of what we do. The clinical research side has another 3 physicians and 1 PhD psychologist who do research, as does most of EOHSI. But our research is different because we actually use as research subjects volunteer human beings rather than 4-legged animals or what we call or laboratory testing. And we recruit subjects in for some of the studies I've told you about. Most of them are healthy subjects, although we have studied people with asthma and other lung conditions, for instance, in our riding studies on the turnpike. The emphasis on those studies right now is on air pollution, as I've discussed for me personally, but we have other faculty members here, like Robert Lombach, who are looking at working together with me and others to work on air pollution studies. In addition, Dr. Lombach has a study funded again by CDC of water pollution in an environmental justice community in South New Jersey. The water pollution is with what are called PFAS, or polyfluoroalkylating substances. And these are chemicals that are used in making waterproof things like Gore-Tex, but they've seeped into the water supply from industrial facilities down in this town in New Jersey, Paulsboro, New Jersey. And there and many, many, many other places in the U.S., these chemicals, which can affect your metabolism in adverse ways, we're studying their levels in the water supply and in the individuals. In addition to that, our colleague, psychologist Nancy Fiedler, is studying the health effects of pesticide exposures to young children, even before they're born, and following them for years forward in major studies, federally funded studies in Thailand. Other important emphases of what we do is our clinical studies are really pretty involved in what we call translation, which is taking ideas that somebody's developed on the laboratory bench, doing experiments again in test tubes or with animals, and applying them to a human situation or a population situation to further understand how those laboratory studies may apply to individuals and populations that will inform us when we try to design policies to protect public health. The last aspect of what we do in our research is engage with the communities in New Jersey. So we engage with the communities, we reach out to them to find out what is important to them in terms of the research we're doing, like the COVID research we did, or some of the air pollution research, and we try to get them not only to give us their ideas for things they're concerned about, but ideas about how we might best do those studies, or even to help us participate in by helping us recruit individuals or making us aware of situations that might need to be addressed.